Hello, welcome to AMCI Saturday Study Session, or SSS. I'm Mrs. J, Curriculum Director here at AMCI, and I am delighted to present AMCI Lead Instructor Ms. Tamika along with her guest. Without further ado, let's get started. Take it away, Ms. Tamika.
Good morning. Good morning. How are you guys? I see Miss Cheryl in there. Who else do I have in here? I have Miss Andrea and Lisa, Renata, Sabrina. It is so good to have you guys with us this morning. How you doing, ladies? Good morning. All right. Hey, Soma. All right, guys, we're going to jump right to it. I know your other classmates will be joining us, but we're going to get going on this nervous eye and ear this morning, okay? We got a lot of ground to cover. And y'all know I have to have my coffee, but have you ever been to Starbucks and they don't spell your name right? It don't taste right when they don't spell your name right. I don't like that when they don't get it right. It's got to be right so it tastes good, okay? Your time scenarios, and we're going to go ahead and get right to it. All right, Miss Lisa, I'm glad that you have got that computer up and running. All right. All righty. So, CPT copyright 2020 American Medical Association, all rights reserved. CPC is a registered trademark of the AAPC. AAPC content found within this presentation is copyright of AAPC. Keyword concept FTR, Chun, AMCI Fab 7, AMCI ICD 10, Flip, Tap are trademarks of AMCI. All right, don't forget at the end, you guys know why we want your feedback. It is very important. It does help AMCI deliver quality classes to you, our wonderful coders. It helps your instructor help you. And that is my goal, is to help push you towards that certification. No feedback means no good. So I want to hear from you. All right. Let me know what works. Let me know what you like to see more of to help get you to that goal. Okay. All right. We are going to start. Yeah. Boom. We're ready. We're ready. I got the clock ready. I'm going to have Miss Andrea come and read this first scenario. Okay. And then you'll have 2.5 minutes after she's done. You have the floor, lady.
Okay, coders, we have A 61850, B 61863, C 61867, and D 61870. A 55-year-old man presents with uncontrolled tremors that have become quite severe and are now disabling. A trial of a deep brain stimulator electrode is recommended. The patient is placed in the head holder adapter for the frame. The scalp is incised, exposing the skull using a perforator to make a single burr hole 2.5 centimeters from the midline at the level of the coronal suture, exposing the dura, and is punctured for access. Microelectrode recording and stimulation is done to target and reposition the electrodes to determine the best placement for the neurostimulator electrode. The neurostimulator electrode array is placed in the thalamus and fastened into position with radiographic image monitoring placement. The lead is coiled in a pocket under the galea, which is sutured closed followed by skin closure. What CPT code is reported? You got this, coders.
guys, if you are still thinking about the answer, go ahead and get it in there. All right. Before I spill the beans this morning, do I have any more takers? All right. If you got an answer for me, go ahead and put it in there before we start to go ahead and explain how we got there. All right. All right. So I think most of you have popped those answers in there. So I'm going to go ahead and start talking. All right. So the answer is indeed B. And for those of you who are almost there, I'm going to give you a nudge in the right direction and I'm going to get you there. All right. So for our keywords, we have this 55-year-old man, uncontrolled tremors. The scalp was incised. All right. And they made a single burr hole, 2.5 centimeters. They used a microelectrode recording and stimulation, or an MER. And then the neurostimulator electrode array was placed in the thalamus. All right. So we're going to take a look at code 61850. And we do have a twist drill or burr hole for implantation of neurostimulator electrodes. But we do have the burr hole. All right, but they are talking about cortical, and we are looking at the thalamus where this electrode was placed. So 61850, we would take that one off the table. Okay, so it's little things like that, again, being forensic. Okay, so they started out okay, but there we go. Cortical, that's the issue. This was placed in the thalamus. We're going to continue on. We have code 61863. We have this twist drill burr hole again. All righty. And it's in the subcortical site or thalamus, but it is without the use of the MER. So for that one, yeah, we're going to take 61863 off of the table. And these little things that I'm showing you, those would be things either you want to box or highlight to help draw your attention when you're differentiating codes, okay? So for code 61867, yeah, we've got this twist drill burr hole, and yeah, we're in the right spot, and it is indeed with the use of this MER, or the intraoperative microelectrode recording. So we're going to give that a light yes, because we need to take a look at our final code to be sure. So this one is talking about a cranictomy for implantation of the neuro stimulator, and this is talking about the cortical area. So that procedure is not right, and the location is not right as well. So 61867, we're going to take that one away. And yeah, that's 61860. Look at all those keywords. The burr hole. We have the thalamus, or the subcortical site, with the use of this intraoperative microelectrode. Yeah, this right here, that's a good code. Look at all those keywords we have that are matching up. So 61867 is indeed where we need to be. Yes, the answer is indeed B. Yeah. All right, so how is everybody doing? Okay. All right, so everybody doing okay? So yes, C, I'm sorry. We were going back and forth on that thing. It is indeed C, okay? All right. So I do apologize for that. Yes, it is indeed C. It is not B. Okay. All right. So the difference being without and with. Okay. So for those of you who I flipped it in the chat, I do apologize. All right. So it's yeah, it is indeed C. Okay. Look, even I did not grab my coffee this morning. I do apologize. And I put it incorrectly on my key when I transposed it over, because I have a separate set over here and I did not transpose that correctly. So my apologies to you guys. So is everybody good? So everybody obviously knows the difference between these two was without and with the use of. So it is indeed 61867. So let me say that again. Yeah, you got it right. That's right, Miss Andrea. You got it right. Oh yeah, baby. Okay, so everybody good now? All right. So I think with the correction of that in my explanation, everybody got this thing right, okay? All right. It is okay, Miss Keisha. You already had it right, and so everybody's good, okay? All right. Yep. Everybody's good. All right. My apologies again. Okay. All right, guys. I got you. I got you on this next one. Okay. All right. We're going to keep moving on because you guys are on fire and I got to get my act together this morning. Okay. So I'm going to have Miss Andrea come and read us on out for our next one. All right. Thank you, lady.
Okay, we have A 62350 C70.0, B 62362 C70.1, C 62360 C70.0, D 62367 C70.1. A patient who has a malignant neoplasm of the spinal meninges is receiving a programmable pump implantation for chemotherapy. The patient is placed in the prone position where the provider made a midline incision overlying the area of the spinal cord. The reservoir was placed in the subcutaneous tissues and attached to the previously placed catheter. Layered sutures were used to close the incision. The patient tolerated the procedure well and was released in good condition. What CPT and ICD-10 CM codes are reported for this procedure? Coders, you have 2.5 minutes.
All right, I see most of you have your answers in there. If you still hadn't gotten it in there, go ahead and slide it in there for me. And I believe that from what I am seeing in the chat, I think that all of you got this one right. That's what I'm talking about. Yes. All of you guys have arrived at answer B. So we're going to move along through this one very quickly. Okay. So I am so proud of all you guys. So you guys obviously know your keywords is that this is indeed a malignant neoplasm, the spinal meninges. They are receiving a programmable pump implantation for chemo, and they are lying in the prone position. This provider has made this midline incision over the area of the spinal cord. And so we're starting here with number one. I just want to bring your attention to this. And many of you might know this, but I'm always telling you guys use these headings as well to be sure you're in the right place. And so this one is talking about a catheter implantation. All right. And we are looking for a programmable pump implantation. So this would help you as well, knowing that anything that's falling up under here, it would not be something you would be using in this case. This right here is for implantation of this intrathecal or epidural catheter. So already we know that 62350 is no good. And we're going to continue on here. Yeah, this is where we need to be, this reservoir or pump implantation. And we're starting with 62360, implantation or replacement of device, intrathecal or epidural drug infusion. Yeah, we're indeed talking about chemotherapy. So we're going to hold on that one with this code family, but it is not a subcutaneous reservoir. So that would not be our code. And you guys already knew, take that one away. Okay. For some of you that took the bait the first time, you took another look and realized, hey, yeah, this common language is good, but this specific code language for this one, that's what was incorrect. All right. So we continued on here. Yeah, we're looking for the programmable pump for this drug infusion. And that right there, yeah, that's good stuff. We're going to give it a light yes. We're going to go ahead and check out 62367. We already know electronic analysis of programmable implanted pump. Yeah, we don't even have to continue on. We already know 62367 is no good, and this is indeed our code. You know, we always just give you for just information's sake what your ICD-10 code would be. But again, I'm always telling you this CPT codes are what it will drive your code selection. So stay in that book as much as you can. And indeed, 62362 is your code. Great job, guys. All right, so we're going to keep it moving. I'm not going to use any more of your time on this one. We're going to move on to the next one. Again, remember, pay attention to those headings and those subheadings. That is another way to help guide you to your code selection. So make good use of it, guys, which you did in this case. Okay, I'm going to read this one because it's quick, and I'm going to save Miss Andrea for those long ones. Okay, all right, so we have A 63050 with M50.21. We have B 63020 with M50.21. We have C 63020, 63035 with M50.91. We have D 63050 with M5091. A patient with a herniated cervical disc undergoes a cervical laminotomy with a partial facetectomy and excision of the herniated disc for cervical interspace C3 through C4. What CPT and ICD-10 CM codes are reported, and you guys have 2.5 minutes. Go ahead, guys. Show us what you got. All right, guys, I am gonna have to go ahead and spill the beans because I want to go and get through as many things as we can this morning. All right, if you do have an answer for me, get it on in there so we can keep on rolling. All right, all right, we're gonna go ahead and unpack this thing. Let's see, I think I have one or two more takers in there. All right, there we go. So we're going to go ahead. We already know here that our answer is indeed B. Okay, so we're going to take a look at how and why that is indeed your answer. And for those of you who were close, we're going to get you even closer. All right, so you didn't miss it by much. We just need to kind of pivot you a little bit in the right direction. All right, so no worries there. All right, so here we go. Our keywords: herniated cervical disc, cervical laminotomy with a partial facetectomy, excision of the herniated disc for cervical interspace, C3 through C4. Right? We're going to start here. We're going to go with the laminoplasty because this is our first code here. So we're going with 63050. This is talking about a laminoplasty. We're repairing the lamina here. Remember your medical terms. You guys know how I feel about the medical terminology, but this is indeed a laminotomy. So right off the bat, you know I love to get it to 50-50. Yeah, this is the incorrect procedure, and already A and D, we're at 50-50. Okay. All righty. So we're going to go ahead and now we're going to start here with 63020. This is indeed a laminotomy with Hemi laminectomy and a decompression. We got a lot of good stuff going on. We have this partial facetectomy. All right, there we go. Lots of keywords here. And then we have this herniated cervical interspace disc, one interspace. Okay, so we know this one right here, this matches the most keywords. So already we know we're in the right spot. And indeed, this is present in both C and B. Okay, so now we've got to take a look here as to what this 63035 is. This is for each additional interspace, okay? So for that one, we don't have an additional interspace. We have two segments, but the interspace is the area in between, the cushy portion between C3 and C4, all right? And so we don't need that. We only have one interspace. We don't need an additional one. So indeed, B is the correct code, and you guys know this is for completeness sake, this M5021. Indeed, this is for other C3 through C4 cervical disc displacement. All right, and indeed, B is the correct answer. Okay, and yes, B is the correct answer. Soma, my apologies. I think for most of you guys, we got you. We were trying to get in there really quickly, but you do have it correct as well. Okay, so I think you guys are off and rolling. All right, so we're going to keep on going. All right. All righty. So everybody's ready. I'm sure you guys are. And we're going to keep it moving. I'm going to have Miss Andrea come and read us out for our next one. All right, guys.
All right, coders, we have A 60520, B 60521, C 60522, D 60540. The provider removes the thymus gland in a 27-year-old female with, with myasthenia gravis. Using a transcervical approach, the blood supply to the thymus is divided and the thymus is dissected free from the pericardium and the thymus is removed. What CPT code is reported for this procedure? You got this, coders.
All right. Do we have any more takers this morning? All right. If you got to get an answer in there, we are waiting on you for just one more sec, and then we are going to go ahead and explain this thing. I think we've got everybody in there. So, you guys already knew that A was the answer, so I'm not going to waste much time on it. All right. So, your key words were this provider is removing the thymus gland in this 27-year-old female who has myasthenia gravis. They're using the transcervical approach. The thymus was dissected free and removed. All right, so we're going to start with this 60520, this thymectomy, partial or total. The thyroid thymus was indeed removed. So yeah, we are performing a thymectomy. So this is the transcervical approach. Yeah, that's some good stuff there. So we're going to give that a light yes. We kept going, which obviously you did. And yeah, this common language was good, but the approach was incorrect. So 60521 was incorrect. 60522, again, right procedure, but wrong approach. This was transthoracic, so we took that one away. And then 60540, that was an adrenalectomy, and that was the incorrect procedure. And so 60520 was indeed the correct code. And all of you guys got there in a blaze. A blaze of glory. I'm loving what I'm seeing. Okay. All right. I don't think anybody needs a screenshot of this one. And these are the ones that I'm so thrilled to see you getting right because, like I keep telling you, leave nothing on that table. All right. So, you guys ready for some more code? I know your brains are firing off. I can see it in the chat. I'm going to have Miss Andrea come and read us out for this next one and give you 2.5 minutes. I'm glad to hear it, Miss Susan. She said yes, she's ready. All right, Miss Andrea, you have the floor, lady.
All right, coders, we have A 61521, B 61524, C 61598, and 61616 with modifier 51, and D 61597 and 61616 with modifier 51. A 50-year-old male is diagnosed with a tumor of the skull base just below the occipital tonsils. The neurosurgeon performs a transpetrosal approach to the posterior cranial fossa. He then performs an intradural removal of the tumor of the posterior cranial fossa at the base of the skull. Dural repair is done and the area is closed with Neurolon. What CPT codes are reported? You got this, coders.
All right, guys, I was giving everybody a chance to get those answers in there. And for those of you who needed just a little bit more time, I wanted to give you that time before spilling the beans, okay? All right, so we're going to go ahead and take a look at this one and unpack it, all right? So your answer is C. And if you just missed it, like I said, we're going to help you get there, okay? We're going to give you that little fine little tuning that you're going to need, all right? So this is a 50-year-old male. This tumor is at the skull base. The neurosurgeon is performing a transpetrosal approach to the posterior cranial fossa. The intradural removal of the tumor, it is in the posterior cranial fossa at the base of the skull, and they had a dural repair. So we need to take a look at our FTRs, and the approach is posterior, okay? Transpetrosal approach, all right? The posterior cranial fossa, all right? Intradural or epidural, we do have intradural removal of the tumor at the base of the skull, and the approach and the definitive procedures should match, and we do have posterior cranial fossa and posterior cranial fossa there, okay? So we've got, that's the approach, and the definitive procedure is the intradural removal of the posterior cranial fossa. All right, so that's some good stuff right there. So we're going to go ahead and unpack it, the rest of it, and how we got to C. All right, so we have for code 61518. All right, this is a craniectomy. And then code 61521, this is for a midline tumor or base of skull. All right, I put this up here because, again, like I said, you want to use your headings, okay? This one is talking about a craniectomy or craniotomy, all right? And this right here, we are talking about a dural repair. So 61524, all right, this would not go. So we're taking that one away as well. Okay, so we're in the wrong spot with this one. We're talking about surgery of the skull base. Okay, posterior cranial fossa. Again, let these headings help you. All right, we're talking about, again, surgery of the skull base. So anything following here, that would not apply. We're already at 50%. All right, so this one, surgery of the skull base, we're in the right place. We're talking about here the approach procedures. This is a transcondylar approach. All right, this is not the approach that we had. We had transpetrosal approach of this posterior cranial fossa. So we need code 61598. All right. And again, here's your definitive procedure, base of posterior cranial fossa. And this one, resection or excision of this neoplasm, and this was intradural. All right, that's our definitive procedure. Again, this is matching here. All right, the approach, posterior cranial fossa, base of posterior cranial fossa. We are right where we need to be. And here we go. How do we get to this 51 modifier? If you have one surgeon that performs more than one procedure, then both codes are reported, and we're going to add the 51 modifier to that secondary code. All right, there we go. Use 51 modifier. One doctor does both procedures, and it tells us this neurosurgeon, if they perform this transpetrosal approach to the posterior cranial fossa, and then he performed this intradural removal of the tumor at the posterior cranial fossa. So indeed, C is your answer. All right. I'm glad you had an aha moment, Renata. Yes. All right, Miss Cheryl. Yes. Sometimes it can be an interesting one. So I wanted to bring you guys attention, draw your attention to definitely these FTRs. And I would advise you, particularly when you get in this section, you see anything like this on your exam, pay attention to where you are. If you're talking about surgery of that skull base, be sure that you are in the section with those codes. If it's leading you over here, remember this isn't what was happening. So anything falling there, you could get rid of it. And you see how quickly we were able to eliminate two of them. And I love when you can immediately get it down to 50-50, so you can spend your time being more forensic and dissecting these codes to get to where you need to go. All right. Yeah, get those glasses out if you need them, the forensic ones, okay? If anybody needs a screenshot, go ahead and grab it, and we're going to keep on moving. All right, we're going to continue to cover some ground. I know you're ready. You guys are working out. You guys are working these brains. Let's do it, guys. All right, Miss Andrea, you have the floor.
All right, coders, we have A 63087 with modifier 52, 63088 modifier 52 times 2, B 63085 modifier 62, 6308662 times 2, C 63087 modifier 80, 63088 modifier 80 times 2, and D 63085 with 63086 modifier 82 times 2. A 47-year-old female presents to the OR for a partial corpectomy to 3 thoracic vertebrae. One surgeon performs the transthoracic approach while another surgeon performs the 3 vertebral nerve root decompressions necessary. How should each provider involved code their portion of the surgery? You got this, coders.
All right, if you've still got an answer for us, go ahead and get it in there. All right. And if not, we're going to go ahead and unpack it. All right. So I think most of you got there. If you didn't, it is quite all right. We're going to get you there. All right. That is always the goal. So if I got any more takers, go ahead and get that answer in there for me. I'm just holding off for 1 or 2 more secs because I want you guys to have a chance at it. All right, so we're going to go ahead and do our thing. You guys did outstanding. Yeah, the answer is B. All right, most of you got there. Okay, so how could you have coded this right off the bat? All right, so, all right for these codes in this scenario, all right, the guideline states that when two surgeons work together as primary surgeons performing distinct parts of the spinal cord exploration, decompression operation, each surgeon should report his or her distinct operative work by appending modifier 62. So looking at that, what would that have where would that have gotten you to right off the bat? Okay, you guys already know it. Yeah, it would have put you right there at B. All right, so we're gonna take a look, though. You know I'm gonna unpack it all the way. All right, but I always like to bring your attention to ways that you can. I like to call it. You could backdoor it. All right, so your main terms were 47-year-old female, partial corpectomy to 3 thoracic vertebrae. We had one surgeon that's performing the transthoracic approach, while another surgeon has performed this 3 vertebral nerve root decompression. How would each provider code their portion of that surgery? All right, so you guys already know. I already showed you how you can get there with those modifiers, but we're going to unpack the codes as well. All right, so we have the corpectomy. All right, it's a partial corpectomy. So we have here a vertebral corpectomy, but this is a thoracolumbar approach. All right, and we have a transthoracic approach. So 63087, yeah, that's got to go already. You know, I like to get us to 50%, and we are already there. And that's the beauty when you're really just going between two codes to get you on your way. That gives you time to just unpack and pull the glasses out, wipe them off, and get the forensic glasses ready. All right, so 63085, these two are good, but what is differentiating them is this modifier. All right, so we have the vertebral corpectomy, we have the transthoracic approach, we have this single segment that is thoracic. All of that is good stuff. So we know that this is a good code, but it is that modifier. We've got the one surgeon and then we've got another surgeon. All right, so each additional segment, all right, this is for the 63086, all right, because we do have 3 vertebral nerve roots, all right, and so we know we're going to need that one, and we're going to need it twice because we have 3 of those. We accounted for the one and we need to account for the additional ones. That wasn't the sticking point for you guys, and you guys understood this. It was that modifier. All right, so here we go for the following codes. When 2 surgeons work together as primary surgeons performing distinct portions of this spinal cord exploration or decompression, we need modifier 62. All right, and there, that code there, 63085, it does fall there. All right, we would not use this 82. This would be for an assistant surgeon. All right, and no, we would not use the 82. Each one of them is performing a portion. We need the 62, 2 surgeons. All right, each surgeon, and it's asking us, how would you code each provider's portion of the surgery? All right, so that's how we get to modifier 62 and to answer B. All right. All right. So, how's everybody feel about that? Like I said, you guys were doing an amazing job with this one. I know this modifier, that was the sticking point. Okay, that's good to hear. I'm glad you're feeling great, Soma. Miss Keisha, I'm glad that you got it. Felt good, Miss Susan. Yes, yes, Lisa. Yes. And you guys, as we continue to move through these things, you're going to continue to build confidence. If you guys need a screenshot, go ahead and grab that screenshot. And so you'll have it. And if you want to, as we move along, grab a screenshot at the beginning before you start working it so you have a clean slide, and then you can get you one at the end as well so you have something to work through if you want to rework them again, okay? All right, we're going to keep on moving. We got some more work to do. I got to go the right way. What in the Sam Hill? Hold on. Let me just put it on pause there and move on to the next one. I'm trying to do all sorts of stuff that I don't need to do right now. All righty. Yeah. There we go. Let's move on here. Yeah, we're going to go ahead and start with some auditory stuff because you guys have got your good ears on, as I used to tell mine when they were little. We're going to move on into the auditory system and continue with some great coding this morning. You guys are ready. You're showing your stuff. I'm going to take this easy one, and like I said, I'm going to leave all the long ones to Miss Andrea, okay? All right, so we have A, 69205. B, 69220, C, 69200, D, 69210. What CPT code is reported for removal of foreign body from the external auditory canal without general anesthesia? All right, guys, you've got 2.5 minutes, and your time, it indeed starts now. All right, I think I've got everybody in there. If you need to get the answer in there, go ahead and slide it in there. I am thrilled to see that most of you got there in, like, I don't know, 30 seconds, maybe a minute at most. That's good because you really want to see that that quick arrival of an answer when you have something so straightforward so that you have more time to spend on the things that are a bit more involved. So I'm going to move through this one very quickly. Removal of that foreign body, external auditory canal without general anesthesia. All right, so you guys obviously took a real quick look at these things. 69210, that was for removal of impacted cerumen, and we are removing a foreign body. So yeah, right off the bat, that one's gone. For code 69220, this was for debridement. Yeah, again, we're just simply removing this foreign body. So now we're going to head on up here now to 69200. Yeah, removal of foreign body with external auditory canal. Yeah, without general anesthesia. That's exactly what happened. Yeah, we're giving that a light. Yeah, so we're going to take a look here to see what's shaking with 69205. That's with anesthesia. That was without. So we're taking him off the table as well. And that is how you guys indeed arrived at 69200 for your answer. And you guys got there in blazing fashion. Yeah, answer C. And hey, just as a quick tip, when you have little sections like this, and even various sections in your book, my big thing with churning is making sure you have your family circled, but put out there different keywords at the code level. That's like one of my favorite things about chunning, because then it draws your eye. So immediately when you see this, you're like, that's impacted cerebrum, and that's gone foreign body. Let me take a closer look at that. All right. All right. So we're gonna keep on moving because we got some more ground to cover. I'm gonna have Miss Andrea come and read us out on this one, and then you'll have 2.5 minutes. All right, coders, you got this. Y'all are on fire. You hear me? On fire. All right, Miss Andrea, you have the floor, lady.
Okay, coders, we have A 69300 times 2, B 69300 modifier 50, C 69310 modifier 50, D 69120 modifier 22. A 6-year-old female with prominent ears undergoes a bilateral otoplasty. Surgeon makes an incision just behind the ear in the natural fold where the ear is joined to the head, exposing the cartilage. Cartilage is trimmed and shaped, and the incision is closed. Temporary sutures are placed to secure the ear until healing is accomplished. The procedure is repeated on the other ear. What CPT code is reported? You got this, coders.
All right, lots of good stuff in that chat, and you guys are getting stronger. I can see it. I can see it, and I am loving it. I have a sneaky suspicion many of you are going to be exam ready sooner rather than later. All right. So, like I've been telling many of you, trust what you know, not what you're thinking, what you're hoping, or definitely don't trust what you're feeling. Make sure you have these exam books, your CPT manuals notated properly so you can just breathe and calm your nerves and do exactly what you're doing here with us. Okay. Just take a breath and code. All right. So you guys already know how we got there. So again, I'm going to move on through real quickly. If I can share something along the way as far as notating or something, jot it down, but we're going to move through it relatively quick. Okay. This is a 6-year-old female. They've got prominent ears. We got to do something to help this baby. They're going to have a bilateral autoplasty. This surgeon is making this incision. The cartilage is trimmed and shaped, and this procedure is going to be repeated on the other ear. All right, for this one, we have code 69110 starting this code family. This is for excision of the external ear. We're doing a bilateral autoplasty. All right, we're repairing, doing a repair. They're talking about excising. Not only that, they're talking about a complete amputation. No, no, no. We want to keep these ears. We just want to tweak them a little bit, do a little plastic surgery on them. So we're going to take D off the table. All right, we came on down here to code 69310. This is for reconstruction of the external auditory canal, or a meadowplasty. No, we are doing some repairing, but we're not reconstructing the external auditory canal. And so, we're going to take that one off. Again, we're simply following these keywords. Already we're at 50-50. I'm loving it when I see that. All right, so here we go. Repair, and there we go. We're looking at this heading as well, so we know we're in the right neighborhood. Let's find the right house. Let's get the right address. All right, so we have 69300. This is an autoplasty, protruding ear. We got all of that stuff. This is good stuff. Repeated on the other ear. This was the deciding factor. Can I make it times 2 to account for the 2 ears, or do I need the modifier? Boom, right there. We always let you know those what parenthetical guidelines, they rule. All right. Yeah, we have got to report the bilateral procedure with this code using modifier 50. So that is incorrect. And indeed, 69300 with that 50 modifier is your answer. And you guys were on it. And that's exactly what I want to see and where you should be at this point in your coding journey. We're going to keep it moving, guys. We got some more coding to do. All right. Hey, I'm gonna save Miss Andrea for the long ones. Okay. All right. So we have A 69799, B 69667, C 69714, D 69710. A patient with severe mixed hearing loss from chronic otitis media undergoes a round window implant with floating mass transducer. What CPT code is reported for this procedure? All right, coders, you've got 2.5 minutes, and your time, it starts now. All right, for those of you who have not gotten your answer in there, pop it in the chat. And if you needed a little nudge, no worries there either. I'm going to give you that nudge, okay? This particular type of scenario used to drive me nuts, okay? So I'm going to help you to get that confidence that you need with this one, okay? This is a matter of trusting definitely what you see and that what you read is indeed correct, okay? So this patient has severe mixed hearing loss from chronic otitis media. They're undergoing a round window implant with a floating mass transducer. So how do we report for this procedure? It is indeed A. All right, so we've got these other three codes and we're having to use 69799 because there is no code for it. All right, there's nothing that's describing it. All right, so here we go. We have code 69667. This is for a repair, but it is for a round window fistula. All right, so for that one, yeah, round window, but we are having an implant. All right, with this floating mass transducer. So 69667, that won't do the trick. We're going to continue on and we have code 69710. We do have an implant, okay? It's implant or replacement, but it's for an electromagnetic bone conduction hearing device. Still not quite there. All right, we're implanting, but they're talking about an electromagnetic bone conduction hearing device. We are implanting a round window implant with a floating mass transducer, and that is not what's described here. So that one is incorrect. So we're like, okay, I got one more shot at this thing. 69714, yeah, implant, but it is for an osseointegrated implant, and we are again implanting a round window implant with a floating mass transducer, and that is it's just not there. So that one is incorrect. So what do we have left? The 69799, the unlisted procedure for the middle ear. And it is indeed the middle ear because it is chronic otitis media. That's letting you know middle ear. And they are undergoing a round window implant, but it is an unlisted procedure. All right. So middle ear. Yeah. So 69799. That is how you get to your answer. And many of you got there, and some of you needed a few nudges, and then you did pivot and get there. But that, if you see one like that, it is a matter of being clear. Just be clear of what you are coding for so you will understand when you don't see it. That is what these 99 codes, in this case, the 69799 code, the unlisted procedure, that is what it is for. Okay, it is indeed unlisted. That specific procedure was just not there. All right, so for those of you who were just like, oh man, like I'm like, okay, what about this one? Okay, is this closer? Okay, I hope that this clarifies it for you. All right, so no worries if you didn't quite get there. Many of you did, and I'm loving it. And for those of you who just missed it, it won't get you next time. It will not get you again. All right, so we're going to keep on moving and we're going to take a look at our next scenario. Yeah, we're going to do the eye and the ocular adnexa. So here we go, guys. All right, so I want you guys to remember one of the key things in your manual. It is indeed on page 457. Be sure you have notated with these vertical muscles, including your superior and inferior rectus muscle, that these are vertical, as well as the superior and inferior oblique muscles, that those are vertical, followed by your horizontal muscles, your lateral and medial rectus muscles, okay, that these are horizontal. This will be pivotal in getting to the correct code and getting there very efficiently to have that notated on that particular photo in your book. Okay, you're going to watch for that operating microscope with this add-on code 69990. Carefully check that code language and your parenthetical guidelines prior to using this particular code. All right, so with that said, we're going to move on to our next scenario. All right, Miss Andrea, you have the floor, lady. And after she completes the reading of the scenario, you guys know the drill. You'll have 2.5 minutes. All right, lady, you have the floor.
Alrighty, we have A 67901, B 67903, C 67906, and D 67908. The patient was taken to the operating room. The provider everts the upper eyelid and places clamps across the everted undersurface of the upper lid. The tissue distal to the clamps is excised or resected. This tissue excludes conjunctiva, tarsus, Muller's muscle, and the distal insertion of the levator aponeurosis. The remaining tissue is reattached and sutured. What CPT code is reported? All right, coders, you got this.
Look at these answers in this chat. Y'all are gonna make me tear up. My kids will tell you I'm the mama that's screaming the loudest at the games, okay? With no shame. And I'm sure you guys are not finding that hard to believe, all right? Always know that, hey, Miss Andrea and I, we're here to be your biggest cheerleaders, okay? And to just nudge you guys. If anybody still needs to get an answer in that chat, go ahead and pop it in there, all right? All right, so here we go. All right. And you know what, Miss Lisa, you're going to get that certification and you are going to be just fine. All right, here we go. We're gonna do this thing. All right. So the answer is D. And look here, all of my superheroes in this chat, you guys got it right. You guys got it right. So I'm gonna move through it real quick. Okay. This patient was indeed taken to that operating room. They everted the undersurface of that upper lid. The clamp was used to excise or resect the tissue distal to the clamp, and the tissue includes the conjunctiva, the tarsus, Mueller's muscle, and the levator aponeurosis. So we have for code 67901, we have repair of blepharophoritis. All right, blepharophoritis is simply drooping of the eyelids, but this is using the frontalis muscle technique. And no, that's not what we're looking for. All right, so 67901 off the table, but this code family is good. We love this common code language, and you guys already figured that out. I just always nudge it and just reinforce it again. All right, so repair of the blepharophoritis, tarso, levator resection. This is for the internal approach. All right, so no, that's not what happened either. So we're taking 67901 off the table as well. What about this one? All right, still repairing of the blepharotosis. Jeez, and I even had my coffee. All right, so 67906, this is for superior rectus technique with a fascial sling. All right, that did not happen either. So 67906, that's not the code. But boy, oh boy, when we get down here to D, there we go. Conjunctival tarso-Mueller's muscle levator resection. All right, or e.g. Facinella savant type. Yeah, that's our code right there. We've got all these matching keywords that we pull from our scenario. All right, and this is for this blepharotosis repair. And so indeed, yeah, look at all that stuff that's matching here and up here. Yeah, 67908. That is the proper code. And you guys got it. I'm loving it. I'm loving it, loving it, loving it. Like I keep telling you, leave nothing on that table when you're on that exam. We're going to keep moving because you guys are moving. And so we want to continue to give you more scenarios. And you guys know I have a whole lot of stuff in my treasure chest. Come on, Miss Andrea, and read us out. And then you guys, we're going to do 2.5 minutes again. All right, Miss Andrea, you have the floor, lady.
Alrighty, we have A 67229 modifier 50, B 67229 times 5, C 67229 and 69990, D 67229. An infant born at 33 weeks underwent 5 photocoagulation treatments to both eyes due to retinopathy of prematurity at 6 months of age. The physician used an operating microscope during these procedures. These treatments occurred once per day for a defined treatment period of 5 days. How would you report all of these services? You got this, coders.
All right, how we doing, coders? How we doing? You guys are doing some amazing stuff in that chat. I'm seeing some coding pros at work. That's what I'm seeing. That's what I'm seeing. All right, okay. If you didn't quite get there, I'm going to give you that little nudge, all right? But most of you got there and just needed a little bit of a nudge to pivot in the right direction. So I'm not going to spend much time on this one either. And I would suggest if you have not gone to the boot camp yet, that you go. We'll be doing that one later on this month, and I'll be there with Miss Rochelle. And when you come up with your testing plan, the way you guys are showing such strength with this section, I would say you should probably consider making this one of your master 7 sections because you guys are doing outstanding. Okay. All right. So for your keywords, we have this 33-week-old infant underwent 5 photocoagulation treatments to both eyes due to retinopathy of prematurity. They are using this operating microscope, all right, once per day for a defined treatment period of what? 5 days. All right, so the answer is indeed A. All right. And so we have for 67229. All right. So it was really a matter of understanding how to use these guidelines because all of them have the same code. Yeah. Treatment of extensive or progressive retinopathy, 1 or more sessions. All right. This little person had treatment of 5 days. All right. Preterm infant, they were less than 37 weeks. This baby is 33 weeks, so we were good there as well. All right, so these codes fall under destruction. All right, and it's including that treatment of 1 or more sessions that occur at different encounters. These codes should be reported during a defined treatment period. And indeed, that treatment period was 5 days. So it ticks all of the boxes. And again, it was with all of the answers that you had to choose from. It was a matter of what wouldn't apply. We didn't have to do times 5 days because these codes, it's part of the code language. Okay, so this is already telling us 1 or more sessions, no need to do a times 5 to indicate the days. It's part of the code language, so that's why B, that's no good. All right, now for this operating microscope, we do not report 69990 in addition to procedures where you have the use of the microscope that is an inclusive component of the code. All right. And so for these codes here, you wouldn't use it. It's inclusive of these codes. And so we have here with this code series here, 65091 through 68850, this code falls within this code range. So you would not use the 69990 with these codes. And here we are with this one. So we don't need C. All right. So that's why we wouldn't use it, because anything that's here is inclusive of the code language. All right. So we continued on for bilateral procedure. We're going to use the modifier 50 with these codes, and we have both eyes. All right, so we're going to need this modifier 50, and there is our code. It's listing the codes where this applies in 67229. That is our code, so we're going to need that modifier. That's why this one wouldn't work, and A is indeed your answer. Okay, I think most of you got it. Just be sure with this 69990 that you have it properly notated so that you can grab what code is falling in here and when you would not use it. Okay, and so that's the part you might want to just box, or if you haven't done that already, so that you don't get confused about what this means with these codes being listed here. You don't use it with these codes. Okay, but I think most of you got there. I just want to be sure you don't miss it. Again, don't leave nothing on the table. Okay, all right, Miss Andrea, yeah, I'd love for you to read us out for this next one, and after she's done, guys, you'll have 2.5 minutes. You know the drill. All right, lady, you have the floor.
Alrighty, we have A 67916 modifier 50, B 67916 E4, 67914E2, C 67914 modifier 50, D 67923E4, 67921E2. A 65-year-old patient presented with ectropion of the right lower lid. Repair with tarsal wedge excision is performed for correction. Attention was then directed to the left eye. The patient also had an ectropion of the left lower lid, which was repaired by suture repair. Code this procedure. You got this, coders.
All right. I think most of you guys have gotten those answers in the chat because I am seeing some dynamite answers. I'm going to go ahead and unpack it because I want us to have time to get yet one more in here, okay, before we run out of time and we get booted out of here. All right. I want to cover as much ground as we can, and that's indeed what we're going to do. Let's go ahead. For those of you who got close and weren't quite there, I think just a little bit of a nudge and you'll have it. All right. So this indeed is a 65-year-old patient with ectropion of the right lower eyelid. They're having repair with a tarsal wedge excision. And then with the left eye, they have an ectropion as well, but they are having a left lower lid repair by suture. Okay. So the answer is B. And you guys got there pretty quickly. All right. So here we go. This Hick Picks manual, it's got some good stuff in it. And right off the bat, here we go with these modifiers. They are letting us know specifically which eyelid. They're being very specific. This E2 is for the left lower eyelid, and the E4 is for the right lower eyelid. And already we know we are coding for the right and the left lower eyelids. So that's going to help to drive us to where we need to go. They're not even doing a 50 modifier for bilateral. They're being very specific and telling us which eyelid we're coding for. So right off the bat, Hey, whenever you can get it to 50-50, what does that do? It leaves us time to be even more forensic with the remaining codes that we have. In this case, we have code 67921. This is for repair of an entropion. What do we have, guys? An ectropion. That's real forensic right there. Very forensic. This is the difference of a letter. Okay, so even though they're talking about excision, tarsal wedge, but it's for an entropion. So we got to take that one off the table. So 67923, that one's off the table. We take a look here with this code family, 67914, repair ectropion. That's good stuff. Suture. Boom, there we go. Ectropion, left lower lid suture repair. Yeah, we need that code and we're going to continue. Yeah, there it is right there. And then we have repair ectropion. The right eye, we had an excision with a tarsal wedge. There it is, tarsal wedge, right lower lid, and indeed 67916 with that E4 modifier being very specific that it was the right lower eyelid as well. That's how we got to B. All right. Yeah, I see some oh yeah and some yes. Got it. That's what I want to see. All right. We have got time for yet one more. Are you guys ready? I got a sneaky suspicion that you are. So we're gonna wrap it up with this one. I had just a little bit more, but we're gonna do this one and then we'll wrap it up. All right, Miss Andrea. Yeah, Miss Susan said ready, Freddie. All right, we got you. All right, come on, Miss Andrea, and read us out for this scenario, please.
All right, we have A 63050 times 4, B 22600, and 63051, modifier 51, C 22842, 63045, 63050, and D 63050. After a snow skiing accident, Barry had a cervical laminoplasty to 4 vertebral segments. How should you report this procedure? You got this, coders.
All right, guys, that's your 2.5 minutes with just a few seconds sprinkled on top to spare. If you have not gotten an answer in there, go ahead and slide it in the chat so that Miss Andrea and I can take a peek. We're going to go ahead and unpack it. You guys did outstanding. I'm just going to start calling all of you CPCA, okay? I am just feeling it, all right? In fact, I don't just feel it, I know it. And like I keep telling many of you, you got to go with what you know when you get in there. I want you to keep doing what you're doing here when you start that exam. You've got this, guys. All right, so Barry had a cervical laminoplasty, so they are doing some repair for 4 vertebral segments. All right, so the answer is D, and many of you got there. And if you didn't get it the first time, a little nudge, it helped you to pivot in the right direction. So we're going to go ahead and unpack it for code 22600. This is for arthrodesis. Okay, and we are coding for cervical laminoplasty. I love these kind because it's just straight and to the point. It's a matter of matching up these keywords. Okay, so we have 22842, we already know with this add-on code, it cannot be first. All right, boom, off of there. All right, so for code 63050, that is the same code for both A and D. All right, this is for a laminoplasty cervical with decompression of the spinal cord. Sounds good. 2 or more vertebral segments. There it is, y'all. You know, when it is integral to the code language. Okay, no need for that mod that the this particular you don't need the times 4. All right, so we're gonna take it off. Yeah, there are 4 vertebral segments, but we don't need the multiplier because the code language is already accounting for that by saying 2 or more. And so indeed, D is your answer. And you guys got there lickety split. I am loving, loving, loving it. All right. So I have one more, and I'm looking at
Thank
the
you for
clock and
watching
I'm
an
getting
AMCI
antsy about
exclusive
doing it.
presentation.
It's a little bit more complicated, and I don't want time to run out for us. But I'm gonna take a go at it and read it real quick, and I'm gonna give you guys like probably a minute and a half. Just do the best you can. I just want to have time to explain it. Okay. So we have code A. For answer A, 63045 with the 50 modifier, 63048 with the 50 modifier, B, 63020 with the 50 modifier, 63035 with the 50 modifier, and 63035 with the 50 modifier, and C, 63015 with a 50 modifier, and D, 63045, 63048 times 3. An MRI reveals the patient has cervical stenosis. It was determined he should undergo bilateral cervical laminectomy at C3 through C6 infusion. The edges of the laminectomy were then cleaned up with the kerosene, and foraminotomies were done at C4, 5, and 6. The stenosis is central. A fasciectomy is performed by using a burr. Nerve root canals were freed by additional resection of the facet, and compression of the spinal cord was relieved by removal of a tissue overgrowth around the foramen. Which CPT code should be used for this procedure? All right, guys, I am going to give you probably barely 2 minutes, all right, if that, because we got to get out of here, but I just want you to see the explanation for this code. So just take a go at it, and then I'm just going to explain it. Okay. All right, guys, your time is starting now. All right, guys, that is time. That is time. All right, so I have already went ahead and highlighted these keywords. Your answer is D, and many of you got there. It was a split, okay? And so I'm going to go ahead and get you there. All right, we're going to go ahead and unpack this thing. For code 63015, it is for a laminectomy. All right, and we are having a laminectomy, but this is without the fasciectomy, the foraminotomy, or the discectomy. And so we're taking that one off the board because those procedures did indeed take place. For code 63020, we do have this laminotomy here. We are again looking for the laminectomy. All right, so we've got to take this one off of the table as well. Already, you know how I like to get it to 50-50. We're already there, y'all. And so what is separating us? We've got different modifiers and we've got a multiplier. Let's take a look here. For 63045, indeed, we know it's the right code. We've got this laminectomy. We've got the fasciectomy because we have the resection of the facet. Okay, so that is a fasciectomy. We've also got this foraminotomy, unilateral or bilateral. There we go. We've got the foramen being relieved with removal of that overgrowth, okay? Or bilateral decompression of the spinal cord. Yeah, bilateral cervical laminectomy. All right, so we are where we need to be, but we don't need this 50 because look at there. Bilateral, when it is inherent to the code language, we don't need to add that modifier to say bilateral because the code language lets us know it's bilateral. When we look at 63048 times 3, we need it for each additional segment. Okay, and remember I was telling you there's a difference between a segment and the interspace. The segment is for each vertebral bone. Okay, so we have C3, 4, 5, and 6. That's 4 when you count them on your fingers. All righty, so 4, 5 is for one single one, and then for each additional, we've got the 3. That gives us 4. All right, and that's why D is your answer. All right, I hope that this one was helpful. Like I said, many of you were there and it was a toss up between A and D, and now you know why. I just was determined to slide that in there. Come on, Miss Andrea, say hey to these folks and then we gonna get on out of here.
Coders, you did an amazing job this weekend. I can see you're working really, really hard. I hope you have an amazing, well, fun, calm, safe weekend, and we'll see you next Saturday.
All right. Thank you so much for your time and your effort today, guys. And hey, leave us a comment on your way out. Thank you for spending these moments with us. We will see you on next Saturday. Have a terrific weekend, guys.
Thank you for watching an AMCI exclusive presentation in partnership with AAPC. Until next time.